Hello friends, welcome to our channel MBBS Made Easy. Today we are going to learn about the topic frostbite, which is freezing cold injury. Firstly, we will learn about the meaning of frostbite. Frostbite is a condition which is caused because of freezing of the tissue which is usually exposed to the cool environments. What are the predisposing factors which are causing frostbite? Firstly, cold weather. Then, if the person is malnourished, and the age group of the individual is very important, where the infants and the elderly persons are usually affected. That is, two extremities of the age are being more affected. And if the person has received any blood transfusion of the refrigerated blood, then there is a chance of getting frostbite. And hypothyroid people are also having higher chance of getting frostbite. Parts which are affected. Usually the parts which are exposed to the cool environments like fingers, toes, ears and face are the usual sites of frostbite. Occupation. The mountaineers, the soldiers who will stay in the outdoors during the winter for a long period of time are having higher chance of getting frostbite. Pathogenesis. Here, there is the ice crystal formation which will subsequently lead to the inflammation of the tissue, which leads to the tissue destruction. Clinical features. The skin usually turns pale and the tissue is duffy in consistency initially, which is not sensitive to pain. But when the frostbite has already occurred, if the part is frozen hard, like water is frozen to ice, the tissue is frozen hard. It is not no more duffy once the freezing has occurred. Edema might develop, hemorrhage can occur, blisters and bleeds can occur, and local gangrene is seen. And treatment. What you will do? The person is having frostbite because of extreme cold conditions, so you have to do rewarming immediately. How you will do rewarming? You have to go take the person and immerse the part which is affected in a water bath, which is heated up to 40 to 42 degrees Celsius. The temperature should not be more than that because high temperatures can burn the tissue and cause further damage. And you have to give analgesics like opioid in this condition because the rewarming process is extremely painful. Now you have to give tetanus prophylaxis because there should not be any infection. Later, you have to give IV heparin because it is a thrombolytic. Since due to the frostbite, vascular thrombosis can occur and which can lead to the conditions where amputation of the limb is required. So if you give IV heparin, it acts as a thrombolytic and clears the vascular thrombosis which has occurred. So IV heparin is given. Later, if all the above processes are not improving the condition of the patient, then we have to go for the surgery where the dead tissue is being removed surgically. But as far as possible, surgery should be delayed because there is a good recovery over an extended period for a frostbite. So we have to wait for some period of time, then go for surgery. Thank you.